Today we will be looking at the CT scan. Who, where, and when. CT scans can be done on anyone, but they are not recommended for children or those who need multiple scans, and they are commonly done when there is a head injury. They are usually used where there is also injury to internal organs or tissues beyond the surface, and they can be done on any part of the body, but the head is the most common. What, why, and how. CT scans show a slide or cross-section of the body, and they help diagnose tumors, look at internal bleeding, or check for internal injuries or damage, and they can look at tumor shape, size, and location, and they also allow doctors to look at tissues without actually having to cut inside of the human body. Who, what, and where. Radiologic technologists perform the actual CT scan, and a gantry is needed, and that's the machine that performs the scan itself. An X-ray system with a computer workstation and patient table is required as well, and they're usually performed at hospitals since they already have a separate room that has all the equipment set up. When, why, and how. CT scans are performed when the doctor initially fears of a serious injury, and it's important to take precautions before receiving one because contrast material can cause allergic reactions or further medical problems from radiation. CT scans begin with a patient lying on a bed that slowly slides through the gantry that rotates around the patient, shooting narrow beams of X-rays throughout the human body. And on personal accounts of CT scans, they are completely harmless and patients do not feel anything, although they could feel nervous. Closing your eyes or taking sedatives can make the patient feel more relaxed. And they can save a person's life because it could detect tumors and internal bleeding before they get too out of hand. And you can encourage people to get one by saying that they will not physically feel anything during the scan.
Created using Powtoon.